Congratulations, your dog just made it through surgery and is doing great. We're going from the intraoperative phase to the recovery and post-operative care phase. Hi, I'm Dr. Weiner from Orlando, Florida, and we're going to talk about wound management and suture and looking after suture care. So, number one, it's really important to restrict your pet's activity, any kind of movement, either jumping, running around, running up and down the stairs, jumping on and off the furniture and out of the car. That certainly does disrupt the tissues as they're healing, and that could either slow down healing time, increase inflammation. Increased inflammation does increase discomfort, makes your pet a little more uncomfortable, but it also can cause some swellings and accumulation of fluid called a seroma. Seroma is when there's a big pocket of fluid around the incision site, and that can certainly be uncomfortable and look scary, and sometimes it can be a good spot for bacteria to dwell in and cause an infection. It's great if your dog feels well enough to run around and all that, but we certainly don't want them to do that. We certainly don't want them to be in pain, but pain usually does inhibit that drive to run around and stuff. So they are going to be on pain meds, so they feel good. They feel well enough to do all that. So it's our job as their caretakers to avoid their activity or restrict their activity and not let them do those things like jumping on and off the furniture, up and down the stairs and all that. The other thing is those e-collars, the cone of shame, and we know, as veterinarians, they hate those things. They knock everything off the coffee table and bulldoze into your legs, and you get bruises and all that. But they are a necessary evil. They do help prevent your dog from licking at those suture sites. And by the way, sutures are stitches. By licking those sites, they do disrupt the healing. They can open the stitches up and cause infection, or they can open the sutures up, which makes them have to come back to the clinic where they have to possibly get sedated again, which increases risk, having to go through another sedation or anesthesia episode, and cost as well, having to have that reclosed. The other thing it does, as I kind of slipped earlier, I said it causes infection. Now mouths are a dirty place full of bacteria, so as if the dog licks this wound, which is a very vulnerable site, that's introducing a whole bunch of bacteria and can certainly cause infection, which then can, again, delay healing and increase in discomfort and cause infection, and it's just bad news there. If it does get infected, it can be as easy as starting some antibiotics, or it could be as complicated as needing to go back in surgically and correcting that, debriding or removing the infected tissue or dead tissue, flushing it out really, really well, and trying it again. Now, it's important to note that veterinarians are trained to take all the as many measures to avoid contamination during surgery. So they're prepped in an aseptic way to avoid as much bacterial contamination from the skin as possible. The instruments are sterile, so there are no bacteria on there. And then post-operatively, try to keep it as clean as possible too. So if everything is followed correctly as far as discharge instructions go, they're not allowed to lick, the wound stays nice and clean and intact and all that, surgical infections are actually fairly uncommon. Okay, so what to look for when you're watching at home. First, it's a good idea to take a look at the incision when you're picking your dog up, so you know what it looks like in the beginning, so you have something to compare it to. Now, of course, if it's bandaged, depending on the type of surgery, some might be bandaged and some might not be. Obviously you can't see it then, but it's always good to take a look at it, and so you have something to compare to. Now, a little bit of bruising, a little bit of redness is totally fine. A little bit of swelling, again, there was a traumatic event that happened to those tissues, so a little bit of swelling and redness is to be expected. Now, anything more excessive than that, so if the skin is brick red or purple or black, obviously that's not good. If the stitches look like they're falling apart. Now, by the way, we may or may not see stitches depending on the type of closing technique the doctor used. Sometimes they do external sutures where you do see them, and sometimes they do internal sutures that dissolve on their own, and those do not need to come out. They just dissolve. So it's a good idea to have them come back into the animal clinic for them to get looked at in about 10 to 14 days either way. But while we're observing at home, they typically look like zippers. Again, especially if you see that those sutures. If not, kind of looks like the jacket here, where the lighting isn't the greatest. But let's see. There we go. It should kind of look like that, where the two edges come together. And that you kind of see a seam, but not really. So look for if the edges are starting to kind of fall apart, kind of like that. The lighting isn't the greatest. I apologize for that. But if the skin's falling apart, if there's excessive amount of draining, again, if a little bit of oozing is okay. So a straw-colored ooze called a seromas fluid, that's a normal inflammatory fluid, and that can be expected by anything like blood or pus, like a white, thick, super smelly discharge. That should be treated. So if you see any of those things, excessive redness, excessive pain as well, oozing, that sort of thing, please call your veterinarian. They may or may not want you to come in. Sometimes they will offer their email address, so you can just take a picture and shoot them an email and say, hey, this is what it looks like. What should we do? Should we just keep monitoring it, or do you think we need to come back in? And they'll let you know. Healing time, usually about 10 to 14 days post-operatively. That's for most surgeries. Orthopedic ones, the skin might heal in about that time, but we're still restricting activity for weeks, if not longer, for those. But just in general, normal return to function is about 10 to 14 days. It is important to note that skin incisions heal from side to side, not lengthwise. So incision that big, it's going to heal about the same time as incision that big. So if you see a really long incision, like if your dog ate a sock and they need to do an exploratory and take that out, it's going to heal about the same time. I know it's a big, scary incision, but it's going to heal about the same time, about 10 to 14 days, just like a little incision, like a cut or something like that. The last thing really is just discharge instructions. Really listen, pay attention to the discharge instructions that either your veterinarian or your vet tech are giving you when you are picking up. A lot of times they'll give you a hard copy as well, because I know when we're picking them up, we're nervous about the surgery, and so when they're talking to you, we know that not everything really gets absorbed, or it might make sense in the clinic, and as soon as you walk out, all of a sudden you have 50 questions, and that's totally normal. But a lot of clinics try very hard to make sure all the instructions are written down for you so you can reference that when you get home. But of course, if you have any questions that are not on there, please give us a call or give your clinic a call to help clear anything up. Discharge instructions typically include things like things that we were already talking about. Restricting activity, keep the e-collar on, avoiding things like scratching and licking and rubbing, all those things. Some clinics might advise you to ice the incision. Sometimes they tell you warm compress, so depending on what type of surgery they did and where we are in the healing process, they'll let you know about that. And then medications too. Sometimes you go home with meds, sometimes you don't. Sometimes they're pain meds, anti-inflammatories, antibiotics. Really depends on the type of procedure that was done. But please follow the written instructions on there. Those medications and those doses were selected and calculated very carefully. So definitely follow those instructions closely, and you should, they were chosen for a purpose, and if they're not followed completely well, then or if they're not followed as they were intended to, they might not work as well, or even could be dangerous. So definitely a good idea to do that. But again, restrict activity, wear a knee collar. I know they don't like them, no one does, but they are a necessary evil. And that's about it. So looking for redness, oozing, excessive pain, and that's about it. So if you have any questions, please call your veterinarian, and they should be able to clear that up. Again, congratulations. Hope your dog's feeling better, and I hope this helps. Take care. Bye-bye.